Thank you, Dr. Esselstyn, for joining me here on this Vegan Plant-Based Summit. How are you today?
I'm very well, thank you.
Great. So for those one or two people on the planet that haven't heard of you or don't know your background, please tell us a little bit about your history as a surgeon and where the epiphany happened, where you realized that a plant-based diet was the solution to heart disease.
Well, it all sort of started. I was after I came back from Vietnam in 1968, having spent a year there as a combat surgeon, I was asked to join the Cleveland Clinic Department of General Surgery, where I subsequently became chairman of the breast cancer task force and head of the section on thyroid and parathyroid surgery. But it was in my role as chairman of the breast cancer task force that in 1979 or 1980, I became increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And that led to a bit of global research on my part. And it was quite interesting to see that there were multiple cultures where breast cancer rates were 30 and 40 times less frequent than in the United States. And it was interesting that if you look at, for instance, Japan, in rural Japan in the 1950s, breast cancer was very infrequently identified. And yet, as soon as the Japanese women would migrate to the United States, but the second and third generation, still pure Japanese American, they had the same rate of breast cancer as their Caucasian counterpart. Even more compelling, perhaps, was cancer of the prostate. In the entire nation of Japan, in 1958, how many autopsy-proven deaths were there from cancer of the prostate? 18, probably the most mind-boggling public health figure I've ever encountered. By 1957, actually by 1978, 20 years later, they were up to 137, which still pales in comparison to the 28,000 who will die this year from prostate cancer in this country. And it was somewhere along the line of this timing that I began to feel that there would be more bang for the buck if we could look at cardiovascular disease. Why? Because as part of this global review, it became apparent that there were multiple cultures on the planet where cardiovascular disease was virtually non-existent. And it just would seem to me that if we could get people to eat to save their heart, they would also save themselves from the common Western cancers of breast, prostate, colon, and perhaps pancreatic. So that led me to feel that I had to start. And since I was still actively involved as a surgeon, the research study had to be quite small, but it was really quite provocative because the patients, as my late brother-in-law used to say, were Essie's walking dead. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for these procedures, or they refused. 5 were told by their expert cardiologist they wouldn't live out the year. And those 5 all made it for 20 years. And it was really quite fascinating to see the kinds of results we got with these patients. Just suddenly, when they were compliant, they just absolutely vanquished any progression of disease. And we often saw striking examples of disease reversal. So anyway, that's kind of a quick background. And when I retired from surgery in 2000, the results with what we were getting with nutrition and reversing heart disease were just too compelling and too exciting to give up. So I've continued working at the Cleveland Clinic Wellness Institute. Yeah.
So in your expert opinion, what age roughly do you think people start to develop the signs for heart disease? Do you think it's early on and it just develops, or is it something that happens overnight?
Oh, no, you're right. No, it does not happen overnight. But you never heard of an 8-year-old boy or girl having a heart attack. Why? they're protected. Why? Because all experts would agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessel, which happens to be that delicate innermost lining called the endothelium, because it is the endothelium that manufactures a truly magic molecule of gas, nitric oxide, which is responsible for the salvation, protection, and preservation of all of our blood vessels. Now, you were mentioning, does this disease come on suddenly or does it take a while? Well, we know from the autopsy studies that were done in Korea, in our war in Korea in 1950s, when we autopsied those young GIs, average age 20, 80% already had gross evidence of coronary artery disease you could see without a microscope. Not enough for their cardiac events yet. And that study was then repeated 45 years later in 1999. This time looking at young women and men between the ages of 17 and 34 who had died of accidents, homicides, suicides. Now, coronary artery disease in that group is ubiquitous. You graduate from high school in this country, you get a diploma, but you also get the foundation for heart disease. Not enough for your cardiac events yet, but there it is. So I want to come back to the gas that is produced by your endothelial cells, nitric oxide. I mentioned that that is the great protector. What does it do? Nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your legs, and your heart, they widen, they dilate, nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming stiffened, thick, or inflamed, and protect us from getting high blood pressure. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaques. So literally, everybody on the planet Earth who has cardiovascular disease, whether they're from London, Berlin, Chicago, New York, or the Isle of Man, if they have cardiovascular disease, it is because by now, in the previous decades, they have so sufficiently trashed, injured, compromised their endothelial cells that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. But the good news is that this is not a malignancy. It's a benign foodborne illness. And once you can get patients to understand, never, ever again are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium can begin to recover, make enough nitric oxide so we can not only halt disease progression, but we often see evidence of disease reversal. Now, what do you want to know what the foods are that injure your endothelium every time you eat them?
That was going to be my next question.
One, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in the cracker, oil in the piece of bread, oil in the salad dressing. Oil injures endothelium, as does anything with a mother or a face. That is to say, meat, fish, chicken, fowl, turkey, and eggs. Also, anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt. Also, sugary drinks, diet colas, Pepsi, and sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. I don't like nuts, peanut butter, nut butters, cashew sauce, or avocado. And finally, avoid coffee with caffeine. Decaf, okay. Coffee with caffeine, not okay. Now, I'm giving you a pretty significant list here, and that's for the patients who have heart disease. But when you think about it, if you listen to the autopsy studies that I just mentioned, if anybody in your audience is over 17 years of age, and they've been eating the typical British, Western, South African, Australian diet, they already have a foundation for heart disease, not only in the arteries to their heart, but also the ones going up to your brain, the carotid. And obviously, if you want to map out a way to keep all of your cognition when you're becoming elderly, you want to avoid vascular dementia and strokes. You don't try to do that when you're 60 or 70. You start right away. Although the oldest patient I have started with me when he was 87, and he refused to take the bypass operation, and he is now 99, and he never had the bypass. Yeah.
So before I go on to dementia and things like high blood pressure and diabetes, where can we find this nitric oxide? What should we be eating?
Where can you find it?
Yeah, it's obviously an antioxidant, and most people will run down to the shop and get some antioxidants, but what foods can we buy it in?
No, you don't want to go down to the health food store and buy antioxidant pills. They don't work and they're going to be harmful.
Mhm.
So we want you to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value. ORAC, oxygen radical absorptive capacity. So this means if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific start. But what I want to share with you now, I want to interrupt my line of thought here a little bit. By now, I hope your audience understands the value of nitric oxide. And they know that it's produced by healthy endothelial cells that line your artery. But you also must know that the endothelial production of nitric oxide is age dependent. So even if you're beautifully healthy at age 50, you now have 50% of the nitric oxide you had when you were age 25. And by the time you're 80, your endothelial production of nitric oxide is down by 70%. So about 10 years ago, we introduced a methodology where we could further stimulate the endothelial production of nitric oxide safely, and at the same time, incorporate the newer research that indicates that mankind has an alternate pathway for making nitric oxide. Okay, what's that? Well, I just finished telling you about what you have on your cereal. Now I need you to chew, not smoothies or juicing. I'm talking to a heart patient now. I need you to chew a green leafy vegetable 6 times a day that is roughly the size of half of your fist, after it has first been boiled in water 5.5 to 6 minutes so it's nice and tender, and then you must anoint it with several drops of a delightful either rice vinegar or balsamic vinegar. Why? Because research has shown us really that the acetic acid from those vinegars will restore and stimulate the nitric oxide synthase enzyme, which is contained in our endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your luncheon sandwich, that's 3, mid-afternoon, 4, dinner time, 5, and of course, I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable, it restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do? The endothelial progenitor cell will replace our senescent, injured, worn out endothelial cells. The third benefit from chewing the green leafy vegetable, and this is the most important of all, When you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew this green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce that green nitrate to a nitrite. Now, when you swallow the nitrite, it is your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. With minimal expense, no hideous side effects, from dawn to dusk, morning to night, all day long, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Pretty exciting. Now, there is a caveat. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And we do not like patients to take antacids because antacids will dilute their gastric acidity and they will be unable to reduce the nitrite to more nitric oxide. Now, you're probably wondering, what are the green leafy vegetables I'm talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets.
Amazing.
That's my story.
Absolutely amazing. So there's been a link to heart disease and dementia, and people don't seem to understand the link. Can you tell us a little bit more about that, please?
Well, when you think about the importance of circulation causing heart disease problems, you can imagine what happens if you have a decreased circulation of blood flow to your brain. Not good. And often when you're eating the Western diet, there is, by age 50, when you carefully study with an MRI, the brains of Americans or those in Britain, you begin to see at age 50 these tiny little white spots, which are little strokes. However, at age 50, big brain, tiny little stroke doesn't seem to be a problem. But suddenly you're 65 and you are able to say, sweetheart, where did I leave the car keys? Well, you get over that pretty well. That doesn't seem to be a problem. But now suddenly you snap your fingers and you're no longer 65. You're now 75. And you look at your sweetheart and you say, sweetheart, where did I leave the car? Well, she's understanding. You get through that and then suddenly you're 85. And you look at her and you say, are you my sweetheart? I can't reverse that. Yeah. You don't suddenly wake up at 85 with dementia. You work hard in all those preceding decades to lay the foundation for that.
What can we do to actually encourage and nurture people into changing their diet for the better?
Well, the only thing that's going to do it is when they get educated. Education is the absolute, and I appreciate what you're doing today. But for instance, when we started this in 1984, boy, you could hear a pin drop. Nobody, doctors, nurses, healthcare workers, nobody wanted to hear this, especially doctors, because when you think about it, with plant-based nutrition, we are an enormous threat to medicine's biggest cash cow. Mm-hmm. And that's always a hard sell. But, once the patient gets this, we've treated now over several thousand patients, and they just, patients really feel so empowered. They are empowered because they know now they were the ones that caused their disease. It wasn't genetics. It wasn't the weather. It wasn't the stress. They caused their disease by destroying their endothelial output of nitric oxide. However, how exciting it is to think that they are empowered again to be the locus of control to restore their nitric oxide and enhance their endothelial cell.
So, what would you say to those people who they go to their doctor, they believe every word their doctor says, and their doctor automatically prescribes them statins? Not a change in diet or a change in exercise or a positive mindset, but here's your prescription for statins.
Well, with all due respect, if you're going to continue to eat the horrible Western diet, the statins may make a modest improvement. But look, the statins have been around for well over 30 years, and still the number one killer of women and men is what? Cardiovascular disease. But what we found that was interesting in the seminar that I conduct, all the patients seem to be self-referred, and many of them have found out long before they ever came into our seminar that they were unable to take a statin because of the severe side effects. Either there are severe muscle cramps, or the statin was injuring their liver, or it was giving them diabetes, or it was giving them brain fog. Interestingly enough, those patients not taking statins did just as well as those taking statins on our program, providing they followed the program correctly. Yes.
Just mentioned diabetes, and diabetes, high blood pressure, and heart disease normally come together either later on in the cycle or in the middle. Apart from changing a person's immediate diet, what other things do you think can benefit them pre-heart disease, pre-diabetes, pre-high blood pressure?
What to do about diabetes and hypertension, and see, they're all so closely linked. Remember what I said about hypertension?
Mhm.
That nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed. And when it does that, it protects you from hypertension, which is why we often see patients who have a diagnosis of heart disease. When they go on a diet of whole food, plant-based nutrition, they are able to get off their blood pressure medication. And often their diabetes comes under control rapidly as soon as they start to lose weight and change their diet as well. So that really all these diseases are so, diabetes, hypertension, and diabetes are so linked. But rather than take drugs, treat the causation. To see the reason that we've had exciting results with heart disease, with all due respect to my cardiovascular colleagues, none of their drugs, none of the stents, none of the bypasses has anything whatsoever to do with treating the causation of the illness. And but once you can get patients to understand the simple science, endothelial cells manufacture nitric oxide. And nitric oxide is the great protector of all of our blood vessels. If you eat and destroy your endothelial cells, you're going to be short and lose out on nitric oxide. That's when you develop your heart disease.
mTOR is responsible for the aging process. What part does the Western diet play in increasing the aging process?
Well, it used to be said that you are as old as your blood vessels, and you should be. Well, I can say that if you eat this way, you almost make your blood vessels eternal. I'm not sure that we can say that about the rest of us.
So if you were to give people today one huge tip, as in diet, lifestyle, what would that be?
Oh, there's one or two tests. You can have a CT angiogram, computed tomography angiogram, or you can have a calcium score. And that'll, either one of those will give you some information about the status of your blood vessels. And if they're positive, that should motivate you to make the changes.
to sum all this up, the plant-based way, not necessarily the vegan way, because there's a lot of oil and a lot of nasty additives in some of the vegan substitutes. But the
Vegan doesn't work.
no, it's
No.
the plant-based way.
French fries, it's oil, it's glazed donuts. No, all the sugar and all the oil. That just I treat vegans and vegetarians for heart disease all the time.
So plants, lots of green things, lots of red and purple things, plenty of water, but not with fluoride in it. What's your perspective on alcohol and heart disease? Does it increase heart disease? Does it have an effect on it at all? Because there's a lot of sugar in alcohol.
Well, alcohol is a toxin. It's toxic to your brain. It's toxic to your heart. It's toxic to your liver. And yet, so many people involved with alcohol that I think I said in my book, I have no objection to somebody having a glass of wine or beer once on the weekend on either Friday or Saturday night.
It's been absolutely amazing talking to you today, Dr. Esselstyn. Is there anything you'd like to add to the conversation?
I would just say, if this is wrapping it up, I would say that the reason that I have a feeling that before us in the near future, there could truly be a seismic revolution in health. And the seismic revolution in health is never going to come about from the invention of another pill, another drug, another stent, another bypass operation. The seismic revolution in health will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness. Thank you.
Great. Thank you so much. Thank you for being here with me today. It's been a pleasure talking to you, and I wish you and your wife and your family all the best.